Great. Yes, I'm Richard Mann, and I'm co-founder of the Bristol River Avon Bioregional Group. I live in Winsley. I'm a parish councillor with Winsley. In fact, they support my involvement with this community forum. And in fact, John Adler had extended the invitation towards Winsley, as you probably know. And there's a sense in which you might think I'm over the border into Wiltshire, but part of what I'm going to do over these next few slides is challenge that impression. And I offer the bioregional approach as something that the forum might like to take forward as a guiding approach to its work on the climate and biodiversity emergencies. So have a next slide. I think we're all well aware that we've been told recently we're now code red for humanity. We absolutely are already seeing climate change having serious impact and loss of life around the world in various places. Fiji, for instance, is a place I'm aware have been struggling in recent times. Next slide. But of course, this problem seems enormous to us. You know, how on earth do we tackle it? It's on a global scale. And that's where I think the bioregional approach, which in fact has been around for some decades, but is gaining more traction currently, with probably a dozen bioregional groups now up and down the UK, may come to help us. So next slide. Basically what a bioregional approach does is provide for us a natural subunit, something that an area within which we can work meaningfully alongside nature. And it makes things feel possible and engaging. And as I'll tell you a little bit more later, it has particular features of coming at this issue with a grassroots approach, looking at a sustainable, community-determined regional self-reliance. And rather cleverly, I think, there's a kind of important mindset shift that it can really very importantly help us with. And that's the little bit of journey I'm about to take you on. So next slide. You might think, why jump to the USA? But it's a place where you can find a most extreme example of a problem that I think we are vulnerable to. So if you take Colorado, which is the state identified here, as you'll be aware, in the States very often and in other places like Australia, borders are drawn according to latitudes and longitudes. So it's a human imposed order for a political boundary. So next slide. And yet there is Colorado and its rivers. So Colorado is a very naturally beautiful place with lots and lots of river water catchment areas, and yet our imposition of a political boundary, administrative boundary, kind of ignores the natural order of things. Next slide. So what bioregioning wants to suggest to us is to redefine our communities as places inhabited within a bioregional watershed. So how one defines a bioregion can be done in various ways, but the way that usually makes sense is to take the whole watershed of a river. So for us, I'm saying it would be the Bristol River Avon and all the waters from the source, from its headwaters, all the way out to the sea at Avonmouth. And by flipping in our mind a move from political administrative boundaries to the natural environment's boundaries of a watershed, can suddenly, I think, I must test that with you if it may be in questions later, but it can make us suddenly realize that our very lives are totally dependent on the air, soils and waters in this place. Next slide. And here's a very watery map of the BEMS area. I found this on the internet. It's obviously a kind of a flooding modeling diagram, because the waters here, the rivers here are very full, and you can see the Chew lake or reservoir towards the left of the picture, but on the extreme right of note is that the border between Wiltshire and BEMS is formed, in fact, by the river at one point. So in a sort of political context, you would see me as over the border, but in a bioregional sense, actually, we're all part of the same watershed. Next slide. So there's the full, it's not a very sharp slide, I'm sorry, but that is the Bristol River Avon catchment, Royal Wootton Bassett top right, Westbury bottom right, and then Thornbury top left. And somewhere along the middle, you'll see the sort of the central highway, as it were, of the Avon, Bradford-on-Avon to Bath, to Keynsham, to Bristol. Next slide. So what are the practical applications of a bioregional approach? Well, I think it can help us work towards the benefit of the whole bioregion. I think importantly, we can try to work with nature, alongside nature. And because this is a unit that has meaning for our lives lived in this place, then as we work to improve the situation locally, we're actually living the effects of the changes that we're trying to effect for the better. And I think importantly this time, when we realise that to some extent our just-in-time global supply chains are under stress and strain, perhaps particularly in the UK through Brexit, then actually having a greater regional self-sufficiency can help protect us from water scarcity, difficulties with energy supplies and food insecurities. I think help us value much more the things that are here. And we can make use of our knowledge of the history of the area. What were the traditional industries in this area? And maybe there are some things there that we can look to resurrect to our benefit. Next slide. A couple of summary slides. Perhaps leave you to read these. Stress the focus here: community, attachment to the land, and a sustainable relationship between us and nature. That should, yeah, it's Tristan's quote, but I would have said people, not men alone. And second summary: there are contradictions, I think, in our global market economy. Doesn't value really self-sufficiency and locally sourced goods and services. And I believe that a bioregional approach points us to greater regional self-sufficiency. And the last slide is simply some contact details, my email, the group's website, and to point you towards the UK Community of Practice group website. And only yesterday, I participate each month in a community of practice, and we had our meeting yesterday, facilitated by Isabel Carlisle at the South Devon bioregion. So I commend bioregioning to the forum as I say, possibly a nature-informed infrastructure, if you like, for the way we might do our climate emergency work.
Thanks, Richard. Very, very interesting. And I could have given you some better maps because I sit on the Bristol Avon Catchment Partnership. So
Great.
put you the link for some slightly better maps. But yeah, it's definitely the approach, interesting approach. And also, just so you're not feeling alone, in the Chew Valley Forum, we also have neighbours from North Somerset, from Dundry, Blagden and Buckham, who join us as well. So it's a precedent that we tried to set up early on to have neighbouring areas involved as well.
Right. I might briefly plug the fact we've got bioregional members in Bath, and there's a meeting tomorrow evening at the Museum of Work, and there's also people we've made connections with in Bristol.
Brilliant. Okay, thanks, Richard. So I'm happy to take any questions either for Dave or for Richard, but also we could, if anybody's got any questions about the two papers that John submitted, or if you prefer, they could be we could defer those until the November meeting when John will hopefully be in a position to answer some questions on those. I'm certainly not going to attempt to answer find details and questions on the papers, but if there's anything sort of in principle. So questions for Richard and David to begin with. You've stunned everyone into silence.
Good sign.
Matt.
Yes, always rely on me to fill a gap. So, David, I just wanted to say that the regional mayor, Dan Norris, held a little consultation last Friday. Were you part of that? And I think Neil and I were part of it as the ward. I think he was meeting with the ward councillors, but we were looking at the A367 corridor, and I reiterated the point that is a corridor, and it isn't just the A367. So that when they are looking at the bus improvements, they look at how the communities interact with the A367 and the relevant bus services. And I did mention the 179 on the B3115 as well. So just to say that took place last Friday. And just to say, I find the bioregional approach very, very interesting, and certainly one of the things I want to address next year, when our officers are no longer tied up with the local plan partial update, is food resilience. Particularly, I think our planning laws at the moment, particularly in BEMS, I'm not sure about Wiltshire, but in BEMS, the planning rules and the area of outstanding natural beauty as well are really, really difficult for anybody trying to grow food. They're fine if you want to grow big crops on a very large scale, but I think that small scale growing, glasshouse, greenhouse, processing sheds in order to get the food into the local economy, very hard to do. And I think I would very much, I hadn't actually mentioned it to John yet, and I was going to mention it tonight, but talking about food resilience as one of the subgroups, I'd definitely like to be involved with that.
Okay, thanks, Matt. David, don't know whether you want to come back on that, or Richard?
Just very briefly, I wasn't aware of that discussion, but it's good to hear that it's going on. And as I understood WECA's broad approach at this stage of the game, yes, absolutely, the A367 and the A37 have been sort of looked at as spinal routes, and that there will be work to map out the ribs coming into those spines in due course, including the B3115, etc., etc. So it's good news, and we'll keep pressing on those issues. Thanks, Matt.
Richard?
Well, yeah, I'll just add, there's a whole movement around community wealth building, which seems to link quite neatly to bioregioning, and it introduces the concept of anchor institutions. So the kind of places, our schools, our councils, our universities, our hospitals, they're not organisations that are going to get up and leave the bioregion. And they could be asked, and I'd ask BEMS members here who can probably tell me very promptly. You employ a lot of people, you probably provide a lot of meals to staff, or at least the hospitals do to their staff, for instance. Where's that food being sourced from? A member of our group is a consultant at the RUH, and she assures me, in fact, it turns out quite a lot of food is sourced very locally by RUH. And they've also, I think, even got some organic or soil association standards. But that's just an example, I think, about how you can actually turn some of the spending power of the big organisations in the bioregion that aren't going anywhere to actually move in the right direction, possibly reasonably quickly.
Okay. Thanks, Richard. Sarah.
Well, I was just going to thank Dave and Richard and say how how important it is. Well, both the topics really that have been raised, that rural transport is really important, and we're working very hard to get its. We're in the process of agreeing a bus service improvement plan with the West of England Combined Authority, and we're trying to get its profile raised within that document. And the bioregional stuff sounds excellent, all about community resilience and natural biological communities. And if it helps, which I can give you a bit more background about the sourcing of food. it's not altogether positive. Well, in the past, BEMS did arrange for all the food for the local schools to be sourced locally through a company called Fresh Range that I think BEMS was involved in setting up. But what happened was that all the schools then had to be academized, and they no longer source their food centrally anymore at all. So it's over to schools now and the academies to do what they can. So BEMS has much less influence than we used to, but at the same time we still have the same great procurement staff working for the council, and we're just updating our procurement policy. So we'll take all the learning points from the work we did previously on food in earlier years and build that into sort of wider procurement, trying to minimize the environmental impact and food miles, as well as issues like modern slavery.
Okay, thanks, Sarah. How do colleagues want to play the two papers? Are you either content and happy to just put them to vote them through? Mark has got a Zoom poll set up, or would you prefer to roll them over to the next meeting and have John just talk you through them at the next meeting? I don't know whether he wants to raise any particular points, but how do you want to play that? Show of hands if you're happy to. First of all, show of hands if you're happy just to roll it over to the next meeting. Okay. All right. Well, I think of the voting members, I think I've got a fairly unanimous that you're happy to roll it over. But it may well be that at the next meeting, because the next meeting is about the budget, so this will be sort of prior to, or probably just after the budget discussion. So if that's okay, but yeah, it seems a shame to just to take it through tonight with John not being here, given that he's done so much work on it. So okay, well look, that's brilliant. That's really good. So we're already 15 minutes ahead of time, and still waiting for two of our speakers to turn up for the next bit. But that's not a problem, because we can crack on if that's okay. Denise, are you there?
I'm here.
You haven't got your camera on.
No, I'm here.
Okay.
I'm here if you need me.
So, Denise, are you okay to start? Is that all right?
Yeah, I might as well.
So it's really pleased. This wasn't deliberately set up that I was going to be chairing the meeting and Denise was speaking, but I'm really pleased that Denise was already on your agenda and is going to speak to you about part of a new project, which again, it's really a shame that John's not able to be here tonight. I'm glad you're recording it, Mark, so you can watch it in his afterwards. But actually, this is something that John has been really involved in getting sorted and getting set up, about getting some village agents down in your neck of the woods. So Denise is going to talk to you a bit about the village agent service and what's going to be provided. So over to you, Denise.
Yeah, we can see it now.
Right. Okay, you okay?
Yeah, that's good, Denise. Carry on.
Righty-ho. So my name is Denise Perrin, and I'm the project manager for the village agents in the Bath and North East Somerset area. First of all, I just wanted to say that the West of England Rural Network is not new to this area. Over the last years, there's a number of projects that have happened to bring enrichment, I would say, in financial and other ways to the area through village halls, community buildings, support for community shops, rural enterprise and transport. So we have been very active in your areas already. And one thing that John said to me is that why have I not heard about village agents before? But that was a few years ago he said that, and he said more recently, I know a lot of people are going to say, why haven't I heard? And it's very, very simple. We started this project initially back in 2010 with a very small amount of money for 1 year in a small area, 10 parishes in the Chew Valley, and we had to just prove our worth, and we've limped along from one piece of money to the next, and more recently we were able in the September of 2012 we added some villages in the Somer Valley and the Cam Valley, so you could, in terms of primary care network, that was the Three Valleys area. But more recently in the summer of this year, June, we managed to add a village agent to cover the Midsummer Norton, Westfield, Radstock, Poulton areas. The reason I'm starting with all these slides is that some of you are saying, well, why bother talking to us about any of this if there's still this horribly blank space on the right-hand side of the map. So tonight I can give you the great news that from November onwards, we are going to be covering all of your areas, which pretty much puts us across all of the rural areas of Bath and North East Somerset. Some logistics are still being worked out, but we will soon be recruiting up to 5 posts to include your new areas. And I will be looking for all your support and connections to help recruit very locally, because we are a project that relies on local contacts, working with local people, and that's the strength of the project. So let's get down to some more nitty gritty. Why village agents? Well, the main thing is that right the way back to when this first concept came was invented, as it were, back up in Gloucestershire, it was very much around a need for a rural focus and for information to be accessible in rural areas on a person-to-person basis, but also to address a lot of those issues around the very low expectations of people living in rural areas. So they didn't expect much, they weren't getting much, and therefore they never asked for very much. So right from the beginning, we were saying, well, actually, you guys matter as much as anyone else. And by not asking, even though that's one of the most difficult things to do in life, is to ask for help, you're not accessing the fantastic resources that are out there. So since 2010, we've been banging away at the drum on rural matters, along with a lot of you guys on this call. So we are getting there, and actually rural matters are very well represented now across Bath and North East Somerset. So we provide a very local go-to information advice service, I would say, one-to-one and for families. But also for organisations as well that want to work in our areas. Now, Joe, I was thinking that I might be speaking after Joe, but Joe's going to explain, Joe Scammell of Virgin Care is going to explain about the Community Wellbeing Hub, which last year was called the Compassionate Communities Hub, which was the go-to place for loads of things during the COVID crisis, and the biggest one-stop shop idea, hugely successful. And we became the rural triage for that service, which meant actually very few people from our areas were having to call the main number, because we were able to deal with a lot of issues that came up, mainly because of our local connections with fantastic parish councils, lots of mutual aid groups that sprang up all over the place, and an amazing army of volunteers who just stepped up to deliver stuff and support local people. But the other theme really of tonight's talk really is around reducing the impact on the NHS and other services. Every other week, Chris and I sit on a meeting and we hear the gloom and doom of what's happening at the RUH, the pressures on the numbers of people that are in beds, that they want to get home, there aren't care packages. And although not all the patients in the RUH are Bath and North East Somerset residents, there are a lot from other areas, the fact is that there isn't a smooth flow out of the hospital. So we are part of a whole initiative and organisational network really to make sure that more people can come home well supported into their own communities, which is where they're going to recover best. But also the other half of that is to make sure that fewer people go into hospitals for very preventable reasons. So and we do all of this work through working one-to-one with people and with families, with carers, signposting, which to whoever literally. So we don't have we don't have a list, a definitive list. Every person that comes to our service, it's a bespoke what's needed for that person. So it might be as simple as needing a local tradesperson to help with a dripping tap, but it might be as big as referring them through to We Care for a fully grant funded wet room. So we do signpost, and we refer onwards to specialists. So we don't pretend to be the experts in mental health. That's Bath Mind. We don't pretend to be able to fill all the referrals are much easier to make and also progress chase. So whoever you are, when you come to our service, you set the pace and we support you along the way, hand-holding you until you are safely in the hands of someone who can finish the journey. But mostly we are encouraging, because of this prevention agenda, to have earlier conversations. And I use this picture to say that right at the very beginning, we were meeting too many people who were at a point of crisis. They were at that tipping point. They were about to go over the waterfall. And, you know, they might say, well, oh, I'm in a bit of a pickle, Denise. Well, a bit of a pickle can be anything from, not being able to find a local person to help with the garden, through to actually they're about to be evicted. So a pickle can be anything, but it is whatever is personal to that person. So we realised that although we could always triage and support and whatever we needed, because there was such a reluctance for people to share their stories, trust, and be trusting of others outside the valley, to be honest, that actually they would sit on their personal circumstances for far too long. So again, we thought, well, we have to, why wait for that waterfall? We have to get to people much, much earlier and be able to put them on if you look back up the river, we need to get them on the bank. We need to get them out of that flow, even though life circumstances will keep pushing you onwards. Of course, there are continual tipping points. So what I want to show you is this journey from the manageable at the bottom there to the impending pickle that I might have got myself in. I've got an example here of something that might have been said to me. My husband's dementia is getting worse. I can't cope, and we can't afford the carer anymore. Now, this sort of situation was coming up a lot last year, and it's certainly coming up this year. Now, that doesn't feel, horrendous. It doesn't feel urgent. But where would you put that person on the scale? They probably felt that they were in just beyond the manageable, but certainly not, I'm in a pickle. But sometimes mentally they're thinking, I'm in a bit of a pickle and now it's time to talk to someone. So we look at the next level of information that we get from them, that they're both in their 80s. Wife's health is deteriorating and she's very exhausted. She is the sole carer for her lovely husband, who she's been with for most of her adult life. The cleaner was not re-employed after they closed the doors to everyone, and so things are in a bit of a mess. It's all a bit unpleasant and a little bit humiliating, to be honest, and they both look undernourished. Now, for me, there are a lot of warning signs here. Dementia, people with dementia had a terrible time during lockdown, really, really bad. A lot of people deteriorated in quite alarming fashion, and the carers having to cope with it. It was very, very distressing. When you when you have to lock the door, hide the keys, and tell someone they can't go out, very, very distressing. And the fact that this lovely lady is the sole carer, most carers, not putting her own health first. Now, in this particular case, this is a sort of an amalgam of two different couples I knew. She had turned down a blood transfusion last year because she didn't want to have any risks of going to a hospital. She was turning down other things as well, but and that was leading to her being extremely poor health and exhausted. And no wonder they were looking both undernourished. They just weren't really bothering. It was just too much effort. So actually, we're well beyond the pickle stage. This is what you would desperately call carer breakdown, and it's an accident waiting to happen, and at least one of them is going to end up in hospital pretty damn soon. Let me just catch up with my notes. So in this case, sorry, I'll just quickly get up. Oops, wrong way. Beep, 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 beep.
You've got a couple of minutes, Denise.
Yeah, okay, nearly there. So, of course, the main thing you've got to get to is avoiding escalation. You can have all of these notes in detail, so I won't go through them. You've got to avoid escalation. You've got to tap into those resources that are immediately available. And then you can start to look at recovery and respite. But absolutely, it is all about, sorry, I keep going the wrong way. It is all about, for us, that there is no wrong door. As soon as people talk to us, as soon as people talk to anyone in the collaborative network, whether that's a GP or someone within the hub structure, that they can get through the right process for them. And on the right-hand side of here, I'm very much talking about the local connections, you people out there who've been supporting people through thick and thin. And going forward, so what we've now got is a 2-year bit of funding where we can prove, like I have done in the past, that not only does this model work really, really well, it works incredibly well if I've got good local connections and collaborations, but I now need your help to achieve that going forward. Just you'll have my details at the end there so that you can contact me directly, and I'm ready to answer any questions later.
That's really brilliant, Denise. Thank you very much, and sorry for making you rattle through it. You did it perfectly on time, actually. So thank you.
All right. Do I have to stop?
So yeah. So what we'll do, we've got Simon on the call now, and Joe's on the call as well. So if we'll take both Simon and Joe, and then we'll have some questions, and then we'll finish off with the little video we've got from Chris Lewis, Dr. Chris Lewis. So Joe, are you okay to go next? I don't want to. Or do you want 5 minutes to calm down? You're okay to go? Excellent. Okay, so really pleased that we've got Joe Scammell on the call today. Joe's from Virgin Care. Worked really closely with Joe now for 3 or 4 years, isn't it? And it's really great, and it's some really good teamwork that's going on now. So I'm really pleased that Joe's able to come tonight. And I'll hand over to you now, Joe. Is that okay?
Yeah. Can I just do a time check, Chris? Have we got?
Yeah, we have plenty of time. You've got about 10 minutes. Is that right?
Yeah, that's absolutely fine. Thank you, Chris. And thanks.
I'll stop you if you go over length.
I'm sure you will. Very hard act to follow, always, Denise, and very sort of passionate and articulate, and I'll try and do my very best. So Chris has asked me to talk about the services, obviously during the pandemic, and I particularly want to focus on one of the wellbeing hub. It's fair to say, and Chris and I were talking earlier, it feels extremely challenging at the moment. I know we'll see that in the press and things, and maybe playing up and playing down responses, but at the moment it feels just like we're in the real thick of it, which is a really interesting feeling. And it feels like, except all the traffic that's back on the road and everybody who's gone back from volunteering to their day jobs, it feels like the volumes, the type of calls, the request for help, the ask is probably like we're in the midst of COVID. And that is a really difficult position to be in, and to keep everybody's spirits up. You sort of had, when you went into the pandemic, the war room type spirit, and now our job is to keep everybody well our colleagues, our partners, our community, to keep them fit and well and healthy, and to try and support people through this next phase the very best we can. And I'm really pleased to say that we've got some great partners and partnership working across our BEMS locality, and we're able to work together to try and deliver that. And I'm sure others will talk about that later. We can take some questions on it. So I won't rehearse, going right back to the beginning of the pandemic, because as I said, it feels a little bit like we're there now. But we were fortunate to be able to work with our partners across the third sector. So Chris and Denise are here today, Dave and Sarah here from the council, and the NHS, and a lot of the other local charitable organisations, to set up this thing that's now called the Community Wellbeing Hub. So at the beginning it was called the Compassionate Communities Hub, and PSG organised the volunteers, as well as the volunteers being in the parishes and in organisations such as village agents. And the idea of coming together was to see what we could do to support and respond to the pandemic, aligning all of our resources. So rather than that age-old thing of people having to call Age UK separately to citizens' advice, separately to also having the mental health, any mental health needs, and also then calling your health visitor, the idea was everybody could call one number, and we would then sort out behind the scenes who was best supported where. So if Denise needed help from somebody in the village agent, she could call and say, well, actually, I've got an individual who needs some support around their money. Citizens' advice would pick that up, or somebody would call into the hub and say, I have no food and no money, which is actually something that's increasingly common now, and I'm feeling low and lonely because of that. And what we would then do is take that call in, work out what the biggest need was first. So that might be an emergency food parcel delivered by our colleagues at the council, then pass that referral on to get more support around a sustainable food option for that family or that individual or the neighbour, and that may be volunteering, it may be through food vouchers, and then possibly also get a call from them from the mental health team, and a befriending call once a day or once a week as the need goes on. So that worked incredibly well, which is why we then developed that into the Community Wellbeing Hub. And we've definitely got further to go. So I think on the first, I don't want to bore people with PowerPoint, but I think, Mark, we've got a couple of slides here that I was just going to draw out some key things around. So the number still continues. The joint work and the way that we're able to work together to support our communities to go through, as Denise said, I think earlier in her presentation, the right front door, that continues and needs to continue now more than ever. What we're actually doing now is we've got multidisciplinary working with about 14 third sector organisations, and every week we review people coming out of hospital, and at Age UK are doing a lot of work around that. So how can we support people to get home, because hospitals are very, very full, as you will have heard in the press. And then we also have a call an hour after that about what can we do to prevent somebody going in, or is there somebody who's really complex, and how and which organisation is the best person to support them. So that might be DHI, it might be Julian House, it might be Carers Centre, and then we'll wrap our services around that one lead individual. So they still very much happen now. I think just to emphasise what keeps us really, really safe, and I know that Dave on the call would agree with me, is that we are co-located with our health and social care colleagues. And that means if we have a complex case, a complex individual or family, we're supported by those, sometimes it's a safeguarding team, the children and families team, the social workers, and sometimes it's actually the health teams and the nurses and the therapists, and all of that enables us to really function safely together. And that's what we really want to continue doing. So it's about working, across the system. And we'll hear later about, I think from the recording with Chris around the integrated care systems. I think arguably this is a small example of actually how services on the ground are already starting to integrate. So Mark, on the next slide, we have a little bit about the hub, which I've talked about, and then we can circulate these, but we've received 15,000 calls since March last year. So a significant number of calls, that most of which were being able to be dealt with just by helping the person or the family to help themselves, to point them in the right direction, to enable them to access, as we said, food, support, advice, befriending. And we have these pods. So I think I said before, is we have, you know, somebody who's got a housing need, we hand that straight over to somebody in the housing pod, and that's DHI working together with Julian House, with Curo, and they work out between them who is the best person to support that individual. So some really good joint working across our incredible community organisations that we have in BEMS, and we're very lucky to have them in our areas. And we've put in some feedback here about people feeling better or worse since they called, and that point, the Compassionate Community Hub. And we've been doing some evaluation work with Bath University to evaluate the hub and to get them to help us to work out where to go next and how to expand that need. We've put in here on the next slide, I've listed our partners. So again, we've seen some of the people on the organisations on the call today, but certainly Citizens Advice and Mine, the council, but we also work with organisations around employment support. So actually, if somebody has no food and no money and accessing employment, they can also access the hub to help. And as I said, we want to look at how we're not just a reactive service, but we really look at the wider determinants of health and continue to be there to support our communities in the right way and be as responsive to that as possible. Looking into the future then, I think we had a really good example yesterday, and this is just the last slide because I know that we haven't got too much time, which I thought was really good. And I think this was actually from the last day or so. So somebody received a food parcel last night and they were really pleased with that and actually looked about the collaborative approach. They were getting some mental health support. They were able to access a befriender and some food. And actually the support that provided for that one individual may save a call to a more acute service later on as well. So we're supporting our community in the right way and early access. And it absolutely is a partnership approach. So we have a board and a partnership board, which is the third sector equally represented with Virgin Care as a community services provider and also the council. And we manage that together, and we talk about how we can expand and develop the service to fit our community provision together, and we challenge each other on doing that. So we really are focusing on this next phase. We thought we were going to be focusing very much at the moment on getting people home from hospital. I haven't mentioned that, but it is really, really tricky. We are seeing increased calls for people who are isolating. We've had some false positives and our positives, and I think Chris Head and I spoke about this earlier on in the week around how that sort of shut down schools, and families are now struggling to access some of the type of the food provision. We've seen the end of furlough, but we haven't seen a significant impact of that so far in terms of employment and employment support. But actually we've asked our employment colleagues working in the teams to try and help us to stimulate our local market, so to try and help us to get more people into care provision, and we'll continue to do that. So overall, a really, really challenging 18 months. I don't think anyone would sit here and say that hasn't been challenging, but I thought that it was good to draw out today for you some of the positive work that has been done with partners, and some of the more positive stuff to come out of the pandemic about how we work together. And in BEMS, I think we've got a really unique opportunity, and we've executed that to do something better together. And I thought that was a really important point to pull out amongst all the challenges that we face and all face daily.
Yeah, great, Jo. Thanks so much. And I mean, it really is about the sort of the cross team working. I think that's what you've managed to instill at the hub, and through the wellbeing hub, and through getting colleagues on board. You know, people don't just have one issue, they have multiple issues, and everybody is slightly different. And it's that way that you can pull in, or we're able to pull in services, whether they're from the local authority, from Dave's team, or whether they're from your team, or whether they're from any of the third sector partners. So it's been really powerful to see that in action, and you know, the outcomes have been terrific. So, and I'm really pleased we've got some elected members on the call this evening who can hear that as well. Although has Kevin dropped off actually? I think he's gone. He's still on call, but Sarah, Matt's had to go, but Sarah's here anyway, and Neil as well. It's great that you guys can hear what's going on. Thanks, Jo. I'm going to bring Simon in next, and then we'll open up to some questions before we have the video from Chris Lewis. So Simon Allen, are you still a new chief executive? Are you allowed to be still called the new chief executive? I think you are.
I don't know, 7 months still new? Probably not. No.
7 months? My God. Okay. Simon Allen is the relatively new chief executive of AGK BEMS. I'm really pleased that he's able to join the call tonight. I've worked with Simon for many, many years, And colleagues on the call will remember Simon from previous lives as well, I'm sure. So over to you, Simon.
Lovely, thanks, Chris, and thanks for the invitation along, and lovely to see some familiar faces after so long. I'm looking at you, Neil. Lovely to see you. So
I'm looking at you. Congratulations.
So if it's all right with you, I think Joe and Denise and Chris have perfectly summed up how important it's been for both members of the community through volunteering and services, whether they are voluntary or statutory, working collaboratively together to seek out answers for people in our community has been the thing that has made the difference. And I think that's what will get us through this, to continue doing that. So having joined Age UK in May, it has been fantastic to then be able to join into the work of the Community Wellbeing Hub and to continue that. But one of the things that I was gifted really when I started was that the organisation had carried out a survey of people aged over 50 to understand, I guess, how life has been for people of that age group during the pandemic. So if it's okay with you, I'd like to just share some of the findings from that before I kind of give you an overview of some of the work that Age UK are doing itself. We were really lucky in that we probably sent out about, sorry, bear with me, there we go. We had about 2,000 surveys and had a 36% response rate, which I think is really valuable in adding some weight to the findings, really. The key thing, it was right across that age range from 50 plus, and it was right across Bath and North East Somerset. And I think for us, it's really focused our minds as an organisation in terms of the direction that we need to go to be able to meet people's needs. But I think it gives us all food for thought in terms of how we can continue to collaborate, because clearly an awful lot of our work is within the realms of health and social care through the Community Wellbeing Hub, but it's really those wider determinants of wellbeing alongside those elements that really make for a good life for people. I think just to drive, as some of you may know, I've worked in BEMS and lived in Bath and North East Somerset for a long time now. But coming back in, I really wanted to reacquaint myself with just some of the numbers, and it was incredible to me that there are over 70,000 people aged over 50 living in Bath and North East Somerset. But between now and 2029, there's going to be a 36% increase in the over 65 population. And I think what we're kind of going through now is quite a transformation in terms of what people expect in later life. That actually the stereotype of the older person is slowly dissipating to some degree. I think people have got different expectations about what later life should look like. I've peppered this presentation with lots of comments that we received from the survey. I won't go through those in detail, but suffice to say that there were lots that were heartwarming, but equally lots that were heartbreaking, as you would imagine. Lots of stats here, and I will share this presentation with you. I think the key headlines for me, there were probably 4 statistics that jumped out for me, and some others may jump out for you, but almost half of the respondents reporting that they had lost confidence during the pandemic. They'd had increased feelings of loneliness, and over half had felt that their health had declined during that time. And I think as things have started to open up and restrictions have lessened, actually what we're finding is that confidence issue is a really key thing. So people haven't been told to shield, to stay at home, took that to heart and acted on it, and shielded. But now that confidence to get back out into the community, I think is really difficult for people to rebuild that, and will take time. And I think that will be a collective effort for all of us across all of us kind of delivering services and within the community. The other thing was, you know, and part of this you could say is as a response to shielding and locking down, but 65% of people responding just wanting to see more activities back in the community. And I guess in some ways that would be natural, wouldn't it? But really interested in the way that we think about how we open up and can reintroduce people back into their community. You know, on the plus side, lots of people reporting that community spirit had grown. And I think that's one of those intangibles that often really hard to measure and to bottle, but something that we really need to pay heed to. And I think the fact of being able to pull together lots of different organizations, but also thousands of people who volunteered their time freely over the pandemic, that for me is community spirit. And you know, Joe was talking earlier about the demand currently on services, whether that's services like ours or whether that's hospital services, social care services. And there's something about how we kind of regenerate some of that community spirit and that war room mentality, as Joe said. The other key thing, and it's something that we've been thinking about and developing for a little while, is clearly over the past year there has been a massive shift to carrying out activity online through digital means, not least this meeting. Absolutely fantastic, and has meant that people could come together in ways that hadn't been as prolific and as prominent as before. And we've seen lots of people who develop those skills, but equally there is a whole proportion of our communities where people don't feel that they've got those skills or don't have that confidence. And I guess one of the concerns that I have is that, and I say this as someone who's a big fan of digital technology, as those who know me will testify to, but my biggest concern is that we build unintentionally a whole new layer of inequality into how we deliver our services. I think some of the national research from the Good Things Foundation would suggest that between 20 and 30% of the population will never want to go online. I've got no inclination to do so and don't want to learn the skills. And it's really important that we are able to respond to those people and are able to provide them information and access to services in the way that suits them. But equally, there's something about providing a way to increase people's digital skills and confidence. So I guess we asked people what the three kind of key things were that they were concerned about in their community. And it fell into three broad kind of categories: practical and physical access, practical wellbeing support, and then the perceptions of aging. And some of this stuff is perennial stuff, which is not always easy to fix, but I think important to highlight and to recognize as things that members of our communities are talking about. There's been a fantastic response from community transport organizations throughout the pandemic. However, I think clearly people responding to our survey raised the issue of buses and transport in rural areas. There were things around pavements and how easy they were to mobilize on and walk on. Disabled parking, lack of it. And I think some of these things were actually, they could be relatively quickly fixed. So, you know, the comment there about contractors using the disabled parking space, there's something about how we make sure that we protect those spaces for those who most need them. Lack of public toilets and so on. So things that will no doubt have been subject to conversation here previously, but things that we mustn't forget as we move into the future. The other part was around practical wellbeing support. So I kind of liken this to, I guess some of Joe's services they are statutory services of statutory social care where somebody's assessed as having a need that can be met by the state. But I think a lot of people were talking about practical wellbeing things. So like support to getting online, social activities, access to GP and hospital appointments, access to information and advice. And I think that just adds to the weight of why we need the Community Wellbeing Hub, to be able to pull all that together to make it as easy as possible for people to access that. Interestingly, though, also people, despite most of the responses saying that people felt safe in their communities, wanted to see a more visible police presence around the community. The next was then around perceptions of ageing, and I think I've kind of alluded to this previously, but a number of responses were people feeling unappreciated in society, forgotten and ignored, feeling discriminated against. And I think there's something about how we can mobilize some of that community spirit to challenge some of those perceptions of ageing. So I at 45 have been told that I am pre-frail, and I'm doing all I can to not be frail. But I think I think increasingly life doesn't stop at retirement, and actually, there's how do we maximize people's input and connectivity within their community. There has been some really positive things to come out of the pandemic. Clearly, my fundraising colleagues at Age UK and my communications colleagues tell me off, because I always look on the bright side, and actually where 48% of people were feeling they'd lost confidence, that means 52% didn't feel that way, and that's a real positive. And I think the more we can maintain that and support those who have felt an increase in loneliness, a decrease in confidence, then the better our community is going to feel about getting older. Plus, people were doing their online salsa and Zumba, which is always a good thing. So really quickly, I'm aware of time, but broadly Age UK's work divides into 3 key areas. So information and advice, who, to be honest with you, I think are a bit of our secret weapon. Throughout the pandemic period, they continued to work remotely with people, predominantly around access and benefits that they didn't know they could access. Phenomenally, this number keeps blowing my mind, but over the pandemic period, they were able to access £650,000 worth of unclaimed benefits for people, which is a life-changing event for people in terms of their weekly and monthly income. And the team are continuing to work and provide that support, and increasingly in a COVID-safe way, doing home visits for people who need that support. So clearly something that's available to your communities. We then have our community connections work, which is mainly our day clubs. So we operate clubs in Bath and Midsummer Norton and Keynsham, providing social interaction and trying to reduce social isolation for people. We've just started some new specialist dementia groups using maintenance cognitive stimulation therapy, which is designed to support people with mild to moderate dementia to delay the progression of the disease. And those groups have been having to operate in slightly smaller numbers to remain COVID secure, but we're looking at ways that we can expand those. The final element, and Joe's alluded to this as well, is our support to be at home and stay at home. The key part of that is our home from hospital service and our home response service to either to help people get home safely, so they've got food in the cupboards, they've got all the practical support that they need to be at home, or indeed working with colleagues to prevent an unnecessary hospital admission. And as Joe says, those teams are incredibly busy at the minute, and I think it's not well, it really is like the peak of lockdowns 1 and 2. It is the feeling on the ground at the moment, and actually the difficulties at the moment of staff having to self-isolate, etc., is really putting a strain on those services. So I'm pleased to say I was out defrosting a freezer this afternoon to do my bit and help. But essentially, what we're about as an organisation, and I think what the Community Wellbeing Hub and the broader work is about building that age-friendly community where people are able to do what they would like to do, where they get the information and advice that they need and can make those choices, make informed choices for themselves, and ultimately about working together. And I think I'll end there. So thank you.
Brilliant, Simon. Thanks very much, and perfectly on time as well. Brilliant. That's really, really good. Thanks so much. And yeah, so we're going to send all these slides around after the call as well. So Dave will send those all round. And yeah, there's some really good quotes in there as well. You got, Simon. So it's a really good, and it's great that we've got you as part of the team now as well. What I was going to do now is I'm just going to take if people have got any questions, I was going to take them from Joe, Simon, or Denise, and then we will have the little video from Chris Lewis. I wanted to get the questions in first, if that's okay. So has anybody got any questions for either of any of our three speakers? Excellent, very comprehensive presentations then, which have said anything.
Did my hand work?
Oh, hi Neil, sorry. Neil's got his hand up, yeah.
Sorry. Well, fascinating evening, so thank you very much. Heartfelt thanks goes to all of you who have been involved in the various issues that have been raised this evening. And it just shows what a tremendous area we have around us, that there's so much community spirit and keenness to try to help things for the future. I suppose amongst Simon's statistics, one that particularly struck me was a 36% increase in people aged 75 or over by 2029. And not least because I will be swept up in that. But I'm wondering what sort of challenges this is seen to present. Can we look forward with positivity to engaging with these people, including me, for a more benevolent and prosperous future, or do we have to try and look to other resources to bring in? How is this viewed? And also, these statistics, Simon, are they, what area do they cover? Is this purely BEMS, or does it cover a wider area?
So just BEMS now, yeah, yeah, just Bath and North East Somerset. Shall I make a start?
You want to start on that one, Simon, and I'll bring Joe in on that. Is that okay?
So I guess ever positive. I think there's a couple of things really, because I think the aging is changing in that now more than ever. I think there is an opportunity for people to age well, and that's really it's a clear. There's lots of work going on around aging well, and I think I think we're in a transition period where clearly the effects of aging will affect people in lots of different ways, but I think there's something about how we can support people to do what they would like to do in later life. So whether that's volunteering or continuing to work, or to take part in things that maintain a sense of purpose. I think that's a really key one for me. I think the other part to it is probably more of a public health kind of angle to it, really, in terms of the more that we can keep ourselves fit and well, that actually it doesn't need to be doom and gloom. I think historically we've kind of viewed the aging population with a little bit of, oh, well, that's just going to mean a massive increase in support that's needed in social care, for example. And whilst that is undoubtedly true to an extent, I think the next 10 years provide us with an opportunity, to be honest, because I think people are living their lives in different ways. And I think part of it is if we can maintain people's connection, reduce any isolation that people feel, then actually, lo and behold, people feel better. And I remember speaking to a GP once who said that actually most of what comes into a GP practice is actually people who've got issues around the wider determinants of health. So it may not be a particular clinical issue, but actually it's the wider issues that really affect people. So, you know, lo and behold, if your mental health declines, then actually so does your physical health. So for me, I think there's something, I guess that's why we're really focused on an age-friendly community, so that people are encouraged to stay connected to their community, so that we can act sooner where there are issues, and maintain people's health for longer.
Thanks.
What has really driven this 36% increase? Would you say, what are the key factors and why has it happened?
Well, I think purely because people are looking after themselves well and living longer, I think, which is a real positive.
Okay, right. I've got a couple of other questions. Sorry, Joe, did you want to come in on that one?
Just a couple of things. One right at the end. I was sat in the Health and Wellbeing Board the other day when they really talked about, you know, there's a 7-year difference in life expectancy in Bath between the highest ward, the wealthiest ward, and the lower super output areas that we have in BEMS, and the less well-off wards. And that's 7 years, and life expectancy is absolutely colossal. So we're doing really well in some areas in BEMS, but the polarization between those who are doing really well and those who are not doing well, it is some of the biggest gaps that we see anywhere in the country, really. So we've got, you know, a significant challenge. We're doing really well, but we have a significant challenge. And I think just to add on to everything that Simon said, which was correct and absolutely accurate, and I completely agree, we are having many conversations, and this is why working together is fantastic, but it is really about working well together to turn the dial to mean that more conversations around the wider determinants of health, as Simon's talked about, rather than how can we stop all the demand that's coming through our health and social care systems and people reach that level of need. Because it's a very reactive environment at the moment. Well, some of it is, where we're reacting to demand, and we really need to work together to turn the dial to say, well, how do we prevent people from needing those services? And I think they're starting to do that, but we've got quite a long way to go. So there would just be the two. There's some really good conversations. I think people are very aligned. I think there are two challenges, Chris. I think the difference in life expectancy across different areas in our local area, and I think the changing more of our time and more allocation to be talked about, you know, prevention and aging well rather than reacting.
Yes, and there's a lot about, you know, Simon, you talked about public health and about what's called the wider determinants of health, but it is absolutely around that. It's about keeping people well rather than treating them when they get ill. And there's a bit of a mindset culture shift around that, and it's quite a challenging one. Okay, I can take a question from Jocelyn next, if that's okay.
Thank you.
Thanks. It's only a quick one, actually, and I may have missed it, but are village agents, are they accessed through doctors' surgeries, or is that where they're based? I didn't realise that we had them in our area. I knew about the Chew Valley area, but I didn't realise that they were in the Preston area.
Okay, I'll let Denise take that one then.
If you're living in Preston, we are available currently, and we're slowly working across all the other areas over the next couple of months. You can self-referral, absolutely. You don't have to come from any specialist organisations. You can just call us up and start talking to us. And literally, my point to everybody tonight is, and backing up on what the other guys have been saying, is that we need people to start talking to people like ourselves much earlier, asking for help much more earlier, planning better, because there's so many more things that can be done at an earlier stage to help people before they get into a crisis, whether that's practical issues that impact on well-being and health, or anything. So it is very, very much that. But certainly, if anyone, just contact me through that email address, and we can get the ball rolling for you.
And I think, Jocelyn, if it's okay, one of the things that Denise was announcing tonight really was that we now have a coverage across all of rural BEMS. In the past, you've been on the sort of the fringes of the Chew Valley activity, I think would be fair to say. You know, we have been working nominally in your area, but it's been quite sort of fringy. Now we're going to change that, and that's now across the whole piece. So we'll be reaching out to all the parish councils. We work through the churches. We obviously work really closely with Chris Lewis at Timmersbury, or the doctors at Timmersbury. So we'll be starting to reach out into your area. So hopefully you'll get to hear about more what's going on.
Okay, thanks.
Okay, excellent. Any other questions for Simon or Joe or Denise? Excellent. Okay. Well, I'm going to say, I want to say thank you very much to Simon, Joe and Denise for giving out your time this evening, as well as everybody else who's been on the call this evening, Dave and Richard as well. If Richard's still there, Richard's still there, but Dave as well. I'm just sort of pulling it together just before we have the thing from Chris. I was made aware of a survey that had been done similar to Simon's one in an area in North Devon with the over 50s, and they were asked to sort of categorize their top 3 concerns. This was an older population in a predominantly rural area. Their top concern was about transport. So Dave, you'll be pleased to hear that. Their second concern was about wanting to reduce loneliness and isolation. And the third concern was about how do we navigate an increasingly complex health system. It wasn't actually about getting well or being made, you know, seeing the doctor or anything like that. It was those were the 3 key things. And I think we've just got ourselves into a position where everything is focused around, and this isn't sort of segueing neatly into what Chris is just about to talk about from a GP's point of view, but health isn't just, it's not just about health, it's about all those other things that actually can make your lives much more bearable. There was another parallel piece of work, Simon, wasn't there, just came out from Public Health England, that during COVID, there were an increasing number of falls for older people because they were less mobile, because they hadn't been doing balancing. So there's a whole school of thought around, well, actually you just need to do balancing exercises each day. You need to do some, you know, do some very low impact exercising, and actually that has a massive impact on your later life. So all those kind of things are things that, you know, colleagues in the hub, colleagues in the teams that we're working with now are all really conversant on. And I actually think there is a change going on. There is a big pot of money that's going to come through under an Aging Well banner. I think, you know, where that sort of comes through, there's some real opportunities in that. So I know we've just been focusing on aging well, but actually it's still the same for any member of the community. But it's been really, really interesting. So hopefully that's been really useful. So what we're going to do now is we're going to play this little clip, if that's okay, Mark. So Chris Lewis is one of the GPs at St Mary's surgery, which is in Timmersbury. Chris is also the Three Valleys Healthcare, which is the PCN out in the Chew Valley, Somer Valley area. He's their representative on the BEMS group. So you'll be familiar with BEMS, which have been delivering things like deliver the vaccination at the pavilion earlier this year. So he's going to he was asked to answer some questions about what was happening with GPs, what was this thing about, you know, face-to-face appointments, what was the issues around that, what was the perception of going on in GPs. So it's a little bit of a strain of, there are some slides, but it's quite a sort of we wanted to bring it up because you know, we recorded it and it's quite a good sort of, you know, dialogue about where GPs are at the moment. So what we'll do, we'll play that, and then if colleagues are okay, that'll last for 13 minutes, and then we'll come back, and then we'll wrap up if that's okay. But we'll be finished by 7:45. You'll be pleased to know. Is that okay? Mark, are you ready to? Excellent. Okay.
So next slide, please, Sarah. Okay. These are the aims of integrating our care system. And I think there's nothing on here that doesn't sound completely laudable. Improve population health and healthcare. Well, if we're not doing that, what are we about? Tackling unequal outcomes and access, I think, is really interesting. And I think that's interesting for our area because there's quite a big diversity of communities that we have. And so we might have to have some interesting conversations within our area about where does resource go. If we are sitting in the lovely affluent Chew Valley, should we be having the same amount of resource as perhaps our colleagues in Radstock? And maybe we ought to be thinking about tackling some of those inequalities. We have really good data now to base these kind of decisions on. My particular area of interest in the PCN is around cancer. And whilst all of our practices are actually compared.
Oh, we've lost the sound, Mark.
To get better screening done and pick up those cancers early. And that's an interesting conversation and potentially a tricky one. Enhance productivity and value for money. The NHS is an amazingly efficient healthcare system globally. It is something that we should be deeply proud of for the outcomes we get for the money we spend, but we can always do better. And some of those conversations will be around how do we use technology? How do we use our consultations better? I know we have a project running on group consultations, something very different. If you're used to a one-to-one conversation with somebody, perhaps it's better done in a group, and there are certain areas where we might be using that in future. And then help the NHS to support broader social and economic development. Sounds suspiciously like levelling up, doesn't it? Next slide, please. So these are the expectations. Decisions taken closer to communities. That's a really laudable aim. I hope it happens. I'm old enough to remember that that's what CCGs were supposed to do, but it was difficult. Collaboration between partners in a place. Now, this is really interesting and really different because if you remember all the way back to Ken Clarke in the 90s, competition was the watchword. That's gone. We now have to collaborate. We have to work together in our healthcare system. And that means that we're sharing knowledge and resources and care with people like Virgin, people like Simon in the third sector, and our colleagues in the RUH. Some interesting conversations and some challenges around funding and contracts and all sorts of things that we have to work together. And these are barriers that we have to overcome. We're not there yet, but the conversations are happening. Strategic commissioning based on population health outcomes. There's a nice little bit of management jargon, isn't it? So what does that mean? Well, we have to think carefully about what we need and where we want to be and what services do we want to commission. And that might mean some difficult choices again. We might not get everything we want, but we hopefully will get what we need. Innovative use of digital and data. I share Simon's concerns about digital divide. I've been in too many conversations where there's an assumption that everybody has internet access. And I visit homes where there's a phone and a TV and that's it. We do have to be very careful that we do not exclude our populations where they do not have access to IT technology. And it's not just the knowledge to use it, but it's also the having it in the first place. Thanks, Sarah. Okay, what does this mean in practice? Yeah, I don't think we need to go on that. Let's move on from that one. Practical changes. These are really practical changes, but they're also challenges. We need to start working together with all of our colleagues. I think that's largely in place. Clinicians are pretty good about talking to one another about the things that we're interested in. And so I think those conversations, we all bring a different perspective, but those are definitely happening. Leadership, governance and accountability, very important. How do we keep the system safe across all these old boundaries? If we're going to be blurring those boundaries, we've got to make sure the safety systems cross them as well. Finances I've talked about as being a challenge. Okay, I think that's probably it. Now, you will not be too surprised to have this up here, I think, at this time. You might be disappointed I'm not going to talk about Jimmy Greaves, even though I am a Spurs fan. We know it's hard to get an appointment. We know. My system has appointments booked up for the next 4 or 5 weeks, and I can see how many are booked up. And I know from how the receptionists battle for the melee at 8 o'clock to get the same day appointments. I was looking for some figures. The British Medical Association put something out. The most recent figures I found was July 21, and there were 17 million GP appointments in England in July this year. If you go back pre-pandemic, because 2020 will not be a good indicator, that's 1 million more than July 2019. So why is it so hard to get appointments at the moment? And I can't say I have an answer for you, but these are just some of my thoughts. So this isn't an exhaustive list, but there's a backlog of problems. There are things that people did not come to see us about during the pandemic. They didn't want to trouble us, but now they need them sorted. The second thing is that under normal circumstances, practices have targets. We have things that we have to do. So that's things like, are we controlling your blood pressure, or have you had your asthma check or your smear, or those kind of things. Last year, those were suspended, but this year, everything is back on the table. And as Helen's alluded to, there are network targets as well. So there's all that work as well as the backlog from last year. There's been a lot of staff turnover. I think the pandemic's made a lot of our staff consider what they want out of their career. And we've had 2 doctors leave us, and we've had all three of our nurses move on from the surgery in the last year. We have been able to recruit, and that's largely because general practice in this area is seen as a highly desirable place to work. People want to come and work in our part of the country, and we are immensely blessed by that. It's not true elsewhere. And some of those, you will see headlines of practices closing and patients being redistributed. Fortunately, we are not in that situation here, but it has been a big change for even quite stable surgeries to accommodate new change and to embed them in the organisations. We're right in the middle of our biggest ever flu immunisation campaign. Some of you probably have had the text messages, and we are doing that. We were working all day Saturday last week. And primary care was the most efficient deliverer of the COVID boosters. Helen said 3 Valleys did 40,000 plus jabs in the first 5 months of this year. We're working against shortages in essential materials. We can't get some drugs, and you've probably heard that in the last month or so we've had a shortage of blood bottles. Who would have thought that we would be short of those? The situation is better. We are phasing those back in over the next few weeks, but it's been a huge challenge to deliver care to anybody but the most sick patients. We are the interface between our communities and a hospital system that is struggling just as badly as we are. The wait time for most specialities is several months. That's not good. And we're the ones who are trying to be the advocates for our patients, trying to get them seen by consultants. And everybody, after the year we've lived through, has unprecedented levels of anxiety. Symptoms that we might previously thought of as fairly minor are causing huge amounts of concern out in the community. And that is to say nothing about the actual mental health problems we are dealing with. So that gives you, it's a bit of a tsunami of need at the moment for one reason or another. We are trying to field that as best we can. And one way we are doing that is by trying to offer a better mix of telephone and face-to-face appointments. Now, I know you've heard this a million times. Telephone appointments are not the same as face-to-face appointments. And believe it or not, we do like seeing you. Most of you, most of the time, we do. That's what we train to do. And we have never stopped offering face-to-face appointments or home visits when we need to. It is really difficult to examine an ear down the phone, or lay a hand on your abdomen, or examine your intimate areas. We just can't do it. So if we need to, we will see you, and we will fit you in as best we can. So really the only thing that has changed for most practices is just that proportion of face-to-face. We always did some telephone, it's just the proportion has changed. And I think there are benefits to having a better mix. For some people, particularly those working or in school, it's actually better to have a phone call. It's more convenient to have a phone call than have to take time off and come and sit in our waiting room. And I think there are some benefits to the technology. I think the text messaging thing has been fantastically helpful. We used that to great effect during the booster campaign. And actually seeing photographs of rashes and skin lesions, and even I'm amazed how good people can get photos of their throat. They are brilliant, really helpful. And not only are they an accurate way of diagnosing a problem, that photo can stay in the notes. So if we need to see something in the future, we've got something to refer back to. So that's great. I think there are some good news areas here. I think the first thing I would say is GPs in this area are genuinely and absolutely committed to the villages and the towns and the communities we serve. And I think the Helen's put the word unhelpful on top of this. And I think that's why this headline is quite so unhelpful, because it sells newspapers to stoke a bit of division. But that's not how I see the situation. It's not why I go to do the job. The absolute joy of general practice is that we are completely rooted in our communities. We know you, and we know your family, and we know your neighbours, and you know us. And that is an extraordinarily powerful partnership to build on. There's none of us that wants to see any patient struggle to get access to the care they think they need. Our practices are assets in our community, and anything that tries to stir dissatisfaction and divide our communities, frankly, doesn't do anything to solve the very real problems. I'm a bit old-fashioned. I don't consider myself to have a job as a GP. I think it's a vocation. And I've cancelled leave this year because I could see that we were short of appointments for patients. I used to have a half day. I don't have a half day at the moment because I'm using it for patient contact. And Denise will tell you that I'm doing my paperwork at all odd hours of the day and night, and you ask her what time she gets emails from me. Sunday mornings, late at night, early in the morning. I'm trying to do the best job I can. I've shunted my admin around. So let me assure you, if you can't get an appointment, it's not because I'm working on my golf handicap. It's because there aren't enough days in the week and there's not enough resource for us to meet the tsunami of need that's out there. Every single practice in our PCN is a training practice. We do it because we like it, but we also do it because we want to train the next generation of GPs who deliver care in the years ahead. And quite often we do fill our staffing gaps with our brilliant trainees. They are really excellent in this area. They put down roots here and we want them to stay. And as you've heard, there's now a whole range of different staff available through the PCNs. There's pharmacists, there's experienced physios who are frankly far better at dealing with musculoskeletal problems than I am. There's the care coordinators, there's the social prescribers, there's the village agents. They all have the time and the skill to really get to grips with the complex social problems when the medical thing isn't really the main issue. Next slide, please, Sarah.
Are you wrapping up, Chris?
Yeah, very quick.
Nice one.
Sure, you've seen this slide before. We've always asked you to think very carefully about which service you think you need. And now there's even more choices available. So I started off the evening by promising one thing you could guarantee in the health services change. Some things remain the same. The commitments that your GP share to giving you the best care possible, that hasn't changed and it won't change. We all wondered at the start of the pandemic what the new normal is going to look like. And I think that the new normal for general practice and for healthcare in general is going to be more of a mix of remote and face-to-face appointments, greater use of technology and a wider range of appointments with other allied professionals. And I would end by challenging us all as a locality to put aside any attempts to put divisions between us and actually engage in a dialogue about what's important to us as a rural area. How do we best use the limited resources available, and how do we harness the skill and the time and the enthusiasm of our whole community to continue to care for every member of our society?
Well, that was great. I even had a recording of me saying, can you wrap up? That was interesting. That was most bizarre. But sorry, so the context was that Chris spoke after both Joe had spoken, Denise had spoken, and Simon had spoken at Chew Valley. That's why his talk made complete sense of referring back to what Simon had said or what Denise had said, because he'd followed on from that. So I hope that was okay. We can't, Chris obviously isn't here for us to ask questions to, although he was talking about Three Valleys. I'm sure I know that in your particular neck of the woods, you've had some particular issues with surgeries around the surgery that you were going to in Somerset that closed, going back up to Combe Down, and those kind of issues. And I've spoken to John at length about that, so I know you've had issues with surgeries down there. But I think, you know, what Chris was saying, I think any GP would be saying and about would be wanting you to take forward. So I'm not going to have any questions on that, if that's okay, because we're not in a position to really answer any questions directly. But I just thought it was really helpful. And again, because that is now on the recording, if you want to play that again or share it with colleagues, you can do that. So we'll let you have a link to the recording afterwards, if that's okay. So the final bit on the agenda for tonight's meeting was about the Bathavon Area Forum terms of reference. And I think what we'll do, if colleagues are okay with that, again, I would like that to be carried forward to the next meeting, and you to work with John through those changes or those forums. I feel grossly unable to, unskilled to be able to do those, if that's okay. Dave, you've got your hand up.
Yes, just very quickly, can we just, I'm absolutely happy that it's carried over to the next meeting. Can we just check there's nobody dialing into the meeting tonight that's got serious concerns or objections to what John has offered, to the extent that they're liable to be showstoppers or blockers next time? Or is everybody reasonably happy?
Okay, that's the floor is open for responses to that. I'm taking that as no one's got anything major at the moment, Dave. If you have, could you reply to the email that you got the stuff sent out to, if that's okay? And then it'll get brought up at the next meeting. Sorry, Dave, unless you have something, sorry, that was very presumptive that you...
No, quite the opposite. I just wanted to make sure that we can expect a fair win next time round.
Okay, all right. Well, that's brilliant. Well, look, thank you very much, everyone, for coming along tonight. It's been really, really useful. Really, thanks a lot to Joe and Denise and Simon, to Dave and to Richard as well for your presentations. It's been really, really great seeing what's going on, but a really varied agenda tonight as well. That's been really great. And thank you so much, everyone. And the next meeting is on the 24th of November at 6 p.m. and you'll get papers sent out from there. Is that okay? All right. Thanks very much, everyone.
Thank you, Chris. Well done.
Thank you.
Thank you.
Thank you.